was listening to the news this morning on my way here, and it said that by next year, all healthcare professionals will be replaced by machines. This is because machines are more precise, accurate, more knowledgeable, more skillful, and expected to produce better health outcomes. So most likely, we will not be here next year. But we all know this can't be true. We all believe that there is a deeper meaning of being a healthcare professional. There is a more profound core of being compassionate, connecting, and caring. You don't have to believe me if I say that I don't think machine will take us over, but allow me to ask history and join me in this journey. We can go through a historical journey and see how healthcare professionals evolved, starting from early societies where healers has always been seen as an essential pillar in their communities. They were mixing spiritual practices with natural remedies as if they were extracting wisdom from the earth. Moving forward to more civilized societies like ancient Egypt, Imhotep is a very renowned physician, and he was not revered only for his medical practices and scientific knowledge, but also for his wisdom. An age where healing were perceived as a science as well as an art. In ancient Greek, we cannot skip Hippocrates, the father of modern medicine, a physician, a philosopher, who was very vigilant to the dynamics and changes in his time, and he set the standard of ethics. These ethics laid the foundation of the current medical practices we practice today. In the Islamic Golden Age that was full of bright examples, Ibn Sina is one of them. He started the empirical approach, which laid the foundation of what we love to call today evidence-based medicine. Healthcare professionals, they adapt to the dynamics and changes and advancements of their age. With all these changes, healthcare professionals are the constant, the adaptive constant. This is why healthcare professionals throughout history are seen as the universal symbol of trust and hope. Can this trust be transferred to a machine? Or should the machine empower healthcare professionals to become more trustworthy and to raise hopes for patients and societies? Let's give a deeper look on our contemporary advancements that we have. Let's talk about digital health.
Healthcare is one of the most important fields.
Is using new computing methods to better understand
AI in the medical space. What does that look like?
Rapidly emerging situation.
Countries around the world have now reported more than 1 million coronavirus cases.
COVID-19 can be characterized as a
A
pandemic.
very simple instruction. You must stay at home.
We're asking everyone to work at home if possible, postpone unnecessary travel.
ابقوا في منازلكم أكبر قدر ممكن وابتعدوا عن مخاطر التجمعات. هذه هي أهم توصية في هذه المرحلة.
So together, and with the rest of the world, we face this unprecedented challenge.
We cannot deny how digital health saved us through the pandemic. Literally, digital health was able to increase the access to healthcare while people were in isolation. This was during the pandemic, but now, post-pandemic, digital health is an integral part of our medical practice. Same with other technologies, robotic surgery, for example. Transferring the skills of a surgeon across continents to the patient with sparing the burden from the patient and reducing the trauma associated with it. This is huge. Same with AI. This plethora of information that gets created, it helps healthcare professionals not only with accessibility to information, but help them in providing an informed decision, a decision support, in order to provide the care that we need to give to our patients, that we commit for. This couldn't have happened without this advancement in technology. So, if you notice here, there is another pattern. There is an embedded pattern in this story. There is something hidden in that historical panorama. Healthcare professionals are adapted to be trusted by patients, to become the universal symbol of trust and hope, always, every time, everywhere. By utilizing the advancement of technologies of their time in order to amplify their senses. Go back to the stethoscope age, it's an amplification of the doctor's hearing. Microscopes are amplification of laboratory sight. A decade ago, we were talking about biosensors and nano-nose that can recognize volatile organic carbons in order to screen for diseases. This is amplification of smelling senses. And AI and machine learning is an amplification of the cognitive ability of healthcare professionals. So with all of these variables, there is one element unchanging, a healthcare professional that is adapting, that is amplifying their power in order to serve patients. This is a message to my fellow healthcare professionals around the globe. In a world where technology advances in an unprecedented pace, let's renew our oath. Let's reaffirm our commitment to patients by pledging to share knowledge, to collaborate, and to connect with one another. Let us care for the health of those who we serve. Let us always remember and not forget that in all ages, throughout all changes, health has always relied on a healthcare professional that is compassionate, connecting, and caring. Thank you.